Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the complications of urethral stricture. The complications of male urethral stricture or retention of urine, urethral diverticulum, periurethral abscess, urethral fistula, effects of back pressure like hydronephrosis, hernia, hemorrhoids, rectal prolapse due to straining. A retention of urine, it may be acute or chronic, may lead to retention with overflow. Clinical features: abdomen is tender for palpation and dull for percussion above the symphysis pubis. Spasm of acute pain occurs periodically as the muscle of bladder contracts. Treatment: he is immediately confined to bed for 24 hours after relief has been obtained. The blood urea is estimated, omnopan and hot water bath is tried. If it fails, catheterization is tried. If blood urea is raised, the catheter is to be indwelling. A small Foley's catheter or Gibbon's catheter is employed. As a last resort, suprapubic catheterization is tried and the cause of obstruction is treated. Diverticulum of male urethra. It is otherwise called urethral pouch. It may be congenital, increased intraurethral pressure behind a stricture due to continued presence of urethral calculus or indwelling catheter in paraplegics. Treatment. Treatment is the excision of diverticulum and removal of cause if possible. Periurethral abscess. There are two types of abscesses. Penile periurethral abscess. It starts as an infection of the glands of litter. It is usually a complication of acute gonococcal urethritis. A tender induration can be felt on the undersurface of penis. If left, the abscess bursts externally and a urinary fistula may occur. Treatment. The passage of bogey usually causes the abscess to burst into the urethra. If it fails, the urethric meatotome is passed through the urethroskop and the abscess is opened by diathermy. If the abscess is behind stricture, it is drained externally. Bulbous periurethral abscess, also called periurethral abscess with extravasation of urine or periurethral phlegm. As in many cases, there is usually no stricture. The condition is due to the spreading of cellulitis caused by streptococci and anaerobic organisms invading the same cellular plane as that of superficial extravasation of urine. Clinical features: pain present in the perineum. Temperature: there is high temperature, rigors and rapid pulse. Tenderness: in the beginning it is present in the perineum, then the scrotum and the penis becomes edematous, then the infection spreads beneath the superficial fascia of abdominal wall. Treatment: antibiotics improve the prognosis. Treatment of choice is the surgery. The perineal abscess is opened, incisions deep enough to divide the superficial fascia are made into the infiltrated scrotum, penis and abdominal wall where it is necessary. When there is retention and the infection is limited to the scrotum and penis, after changing gloves and instruments, the suprapubic cystotomy is performed. If the superficial layer of the abdominal wall is implicated, it is best to drain the bladder by performing perineal ureterostomy. After treatment, After installing hydrogen peroxide into them, the various incisions are irrigated with a weak potassium permanganate solution. The siege baths of the same solution are given. When the infection is under control, the stricture of urethra is treated accordingly. Chronic periurethral abscess. It is situated in the perineum associated with the periurethritis. Cause is the chronic bulbous urethral stricture. Treatment. The abscess should be opened and later the stricture is repaired. Urethral fistula. The cause may be bursting of incision of a periurethral abscess when the opening is in the penile urethra or penoscrotal junction. The amount of urine that escapes at each act of micturition is often small. A fistula following a periurethral abscess of bulbous urethra can be either single or multiple. In the latter case, the fistula originates behind a tight stricture and the patient passes all urine through various fistulae. Watering can fistula. A fistula can also follow external urethrotomy when there is a stricture situated distally. Treatment. A small fistula often closes spontaneously after repeated dilatation of urethra. Scoring the tract with diathermy needle often encourages the closure. Sometimes erythroplasty may be required. That's all about the complications of male urethral stricture, and in the next video I will discuss about some other disease. Thank you.